My name is Brad Leverett. This is my head to toe assessment video. Before the head to toe is started, I'm going to make sure I have all my equipment ready and available. I'm then going to provide privacy for the client. I'm going to wash my hands, and I'm going to introduce myself and get consent for the head to toe. Hello, my name is Brad. I'll be your nurse today. Is it okay if I do a head to toe assessment on you?
Yes.
Okay. And then I'm going to assess his mental status and get his speech, his facial expressions, and a good feel for his mental status. Can you tell me your name and date of birth?
Matt Case, 6/28/89.
Okay. Do you know what day of the week it is?
Wednesday.
Do you know where you're at?
Hospital.
Okay. And as I'm talking to him, I'm assessing his level of consciousness. I'm looking at his dress, make sure it's appropriate. And then I'm looking at his development, making sure it matches up with his age. From here, I'm going to go ahead and start the physical assessment and look at his scalp and his head and make sure that it's, symmetrical and round. There's no lesions. Skin color is even. It looks good. And then I'm going to look at his integument and look at his arms and make sure the skin color is even, there's no lesions and no bruising. His fingernails are clean and good. Capillary refill is less than 2 seconds. The temperature is warm and dry, so everything is normal. And then I'm going to go to assess some of the cranial nerves. I'm going to have him raise your eyebrows, close your eyes real tight. Can you puff your cheeks out? Can you frown and smile? And I'm assessing cranial nerve 7 and having him move his face like that. And then I'm going to assess the sensory and the motor of the cranial nerve 5. I'm going to have him clench his teeth and test and feel for the contraction of the jaw muscles, and that's the motor part of the cranial nerve 5. And then I'm going to assess the sensory. If you'll close your eyes and tell me when you feel something dull or feel something sharp.
Sharp. Dull. Dull. Dull.
And then after I've assessed that, I'm going to go to the eyes. I'm going to make sure they're, symmetrical, they're round, eyebrows look good, his whole face is symmetrical and everything. I'm going to check his lacrimal apparatus, make sure there's no drainage, no edema. Then I'll pull down gently and check his conjunctiva and his sclera. They're white. Conjunctiva is pink, moist. Everything in his eyes look normal. Now I'm going to test some of the cranial nerves. I'm going to check for pupil dilation for direct and indirect and make sure that his eyes dilate like they should. So as I move the light over, I'm checking for dilation, and it should be equal in the opposite eye, which it is. And then I'm going to have him look at an object on the wall and now focus on the pen. And I'm checking for accommodation. And now I'm going to have him watch the pen as I move in, and it has his eyes converge. That's cranial nerve 4, which was good. And now I'm going to do the 6 points. Just follow the pen, not moving your head. Which is good. And that's assessing your cranial nerves 3, 4, and 6, which was all normal. And then now I'm going to move to the ears. And I'm looking for any lesions, any redness, any tenderness. Everything looks good. I'm gonna inspect the inside for any drainage, any excessive cerebrum and everything, which they're all clear. Everything looks good. They're symmetrical. They're both equal size. They're in good right positions on his head. And then from the ears, I'm going to move to his nose. I'm going to check his nose. It looks symmetrical. It's not crooked at all. No signs of broken nose or anything. And then I'm going to palpate. Everything feels good. No redness. No, it's not hot or anything. I'm going to palpate his sinuses for any tenderness. Any tenderness?
No.
Alright, and then I'm going to have him tilt his head back and I want to inspect the inside of his nose. And as I'm looking, I'm making sure there's that it's not dry, it's not irritated or red, there's no blockage, the septum looks good. Then I'm going to have him clog one nostril and blow out the other side and do the other one. Patency is good in both nostrils. And then from there, I'm going to inspect his cranial nerve 1. You'll close your eyes, and I'm going to have him tell me what he smells.
Garlic.
Good. Okay. And then I'm going to inspect his mouth. If you'll open your mouth and get a tongue depressor. I'm looking at his teeth. He has all his teeth. They look clean and brushed. His gums are moist and pink, no irritation or inflammation. His soft palate and hard palate are nice and moist, no lesions or anything. His tongue is nice and pink and moist. I'm going to check his tonsils, which they are barely visible, so I would say they're 1. Can you say ah? His uvula raised and his tonsils moved, so I was assessing his cranial nerve 10. And then I'm going to have him push against the presser. Can you put, there you go. And I was testing cranial nerve 12. Now I'm going to have him swallow. And as I see him swallowing and everything looks good, that's cranial nerve 9 and 10. And then from the mouth, I'm going to move to the neck area. I'm going to inspect, make sure there's no masses or tenderness, or everything looks like it lines up good. The skin looks good. No lesions, no skin discoloration or anything. I'll palpate the lymph nodes. I'll start with the occipital, and then I'll move to the post-article, pre-article, tonsillar, submandibular, submental, and then if you can shrug your shoulders, I'll check the supraclavicular, and then I'll inspect the posterior and anterior cervical line lymph nodes. From there, I'm going to palpate his trachea, make sure that it is, midline and straight, no masses, no tenderness or anything. And then I'm going to now inspect his thyroid gland, which I'll do it from the posterior. I'll check bilaterally, make sure it's even, it's not swollen or tender or anything. After I've palpated that, I would have him lay on the bed at probably a 30-degree angle, and I'll have him look to his left. And I'm looking for any, jugular distension or anything, which he doesn't. If it was distended, that would be a sign of maybe some kind of a cardiac problem, pulmonary buildup. Now I'm going to auscultate his thyroid and his carotid artery. So if you could take a breath in, and when you breathe out, hold it. I'm going to check with the bell of the stethoscope and listen for any bruit. You can breathe. And then I'm going to listen to his carotid for any brewing. And then from there, I'm going to check his arms. I'll check cranial nerve 11 and have him shrug his shoulders against resistance, which is good. I'll have him turn his head against resistance, which is good. I'll have him test the strength if he'll squeeze. Muscle strength is good and bilateral. I'm going to check his capillary refill on his fingers. Less than 2 seconds, which is good. Now I'm going to assess his cranial nerve 8. And for this test, I'm going to hit this and put it on his mastoid. And then whenever he stops feeling it, I'm going to put it by his ear. And he should be able to hear it. Let me know when you don't. Now let me know when you don't hear it. And with that test, the Rhines test, I'm testing the conduction from the bone and then through the air, and there should be about a 15 to 30 second difference there. Now I'm going to do the Weber test, and this is the test that he hears both equal in both ears. Can you hear them equal in both ears?
Yeah.
Okay. Now I'm going to do the whisper test. If you'll just repeat what I say.
Football, basketball, soccer.
Okay. Now I'm going to check his reflexes in his arm, which I'll first check his bicep reflex, if you'll relax. I'll hit it one time there. And then his brachial artery reflex there. And then his tricep reflex, if you'll relax. And then one time there. From there, I'm going to move on to the thoracic. The posterior, if I can have you just turn in the chair. I'm going to inspect, make sure everything's equal, there's no lumps or anything going on. Then I'm going to test for chest expansion, which I'll do like this. If you can take a deep breath in. There you go. Everything is equal. Chest expansion was good and bilateral. Now I'm going to palpate and test for the formatus. If you could say 99.
99. 99. 99. 99.
Fremitus was good. Now I'm going to palpate, and I'm listening for any unusual sounds. Everything's good, and now I'm going to auscultate, listen to his lung sounds. If you could just, every time I put the stethoscope on you, just take a deep breath in and deep breath out. Okay, if I can have you sit back in the chair. And then from the posterior thorax, I'm going to move to the anterior thorax. And once again, I'm going to look. His shirt would be removed so you could see the skin and if there was any lesions or any masses that you might see. You would palpate, make sure there's no lumps, no tenderness. From there, I'm going to percuss and make sure everything's symmetrical and check his chest expansion. Once again, go ahead. If you'll take a big breath in. Both sides of his chest are expanding equally. Good signs of good volume going into his chest. I'm going to palpate for the fremitus again.
99. 99. 99. 99.
Good. And now I'm going to auscultate the lung sounds again on the anterior side. Once again, just breathe. Lung sounds were clear, no extra sounds. From there, I'm going to move to the heart. I'm going to auscultate all the lung sounds with the diaphragm, which I'll start in the aortic, then to the pulmonic, the herbs, the tricuspid, and the mitral. And then I'm going to listen to the sounds again with the bell and see if there's any adventitious sounds on the same locations, the aortic, pulmonic, the herbs, the tricuspid, and the mitral. Now I'm going to palpate and his apical pulse, which will be the 5th intercostal and mid clavicle line. And once I find his pulse, I'm going to count for 1 minute. And after I've counted for a minute and determined that his pulse rate is within a normal range, I would assess the the grade of the pulse, which is a 2. It's a good strong pulse. Up at the neck area, I would also palpate the carotid arteries, and as I'm palpating the carotid arteries, feeling for any thrills, any turbulence coming through, and you want to do it one at a time because your older clients, you don't want to obstruct that blood flow because they could pass out real easily. Now, what I'm going to have to do is have the client lay down, and I'm going to assess his abdomen. So if you can just lay down. As the client lays down, I'm going to inspect his abdomen. I would make sure his umbilicus is good color, is midline in the right location. Nothing, the skin integrity is all good, no lesions, no bruising, no lumps or anything. I'll also, if I need my light, I'll get even and check for any pulses or anything. After I inspect, I'm going to auscultate the abdomen, which I will start at the right lower quadrant and listen for the GI tract movement. And then I'll also listen for any friction rub or your renal arteries and your aortic and iliac from the liver, the spleen, and your arteries. After I've auscultated, I'm going to percuss, and the same direction, right lower quadrant, making my way around. And then after percussion, I'm going to palpate. Just light palpation, testing for any tenderness, any masses, checking the stomach, making sure it's not distended and tight, which it looks and feels, and everything looks okay. From here, I would have the patient roll to his side, and I'll check for sacral edema. Which he has none. Now I'm going to inspect his lower extremities and check for the temperature, any edema. If one leg is bigger than the other, the skin looks even all around. You want to check all the bony prominences and make sure there's no, make sure the skin integrity is good and everything. Now I'll test his flexion and dorsiflexion. If you could push against me, good. And then pull your feet. There you go. And now I'm going to check his pulse, his posterior tibial pulse, and his doralis pedis pulse. Pulses are good. They're at a 2. They're both equal. I'll check his capillary refill on his toes. Less than 2 seconds. Good. Now I'm going to have the client go ahead and sit back up. Normally he would be sitting on the edge of a hospital bed with his feet dangling, and you would, I'm going to check his reflexes, his popliteal reflex. I hit it one time there, and then I would check his Achilles and hit his Achilles right there. From here, I'd have the patient go ahead and stand up. And if you could close your eyes and hold your arms out. I'm performing the Romberg test. Put your feet together, please. I'm checking his balance and coordination, which he's good. It's a negative Romberg test. Cranial nerve 8 would be his balance and everything. Now I'm going to assess his gait. If you could walk heel to toe about 5 steps and then turn around and come back. I'm checking his coordination and his balance. And I'm looking at his gait, making sure it's even, and he's not, favoring one side or not. Good. If I could go ahead and have you lie down one more time. You would normally do this while the patient was lying down to limit the patient going up and down. But if I could have you put your heel on your shin and slide it down and do the other one. And I'm assessing coordination, his cerebral coordination, which is good. You can go ahead and sit back up. You feel okay?
Yeah.
Okay. That's the completion of my head to toe assessment.